Hello, everyone, and welcome to the ConnectSure DRX deep dive into our new game-changing enrollment platform for Medicare sales, PlanCompare Edge for agents. If you're looking to boost your enrollments, simplify your workflow, and close your sales faster, well, you're in the right place. My name is Joshua Smith, and I am the Senior Director of Carrier Relations here at ConnectSure DRX. Today, I'll be speaking with Zach Block, one of our ConnectSure DRX account managers. Zach's got a ton of experience working with agents on the platform using this awesome tool. It's good to have you, Zach. Thanks for hopping on the call.
Thank you, Josh. I'm excited to share how PlanCompare Edge for agents can help agents sell smarter, not harder, and significantly grow their business as well.
Awesome. So let's start with the big question. Why should agents care about PlanCompare Edge, and what's in it for them?
It's a great question, Josh. The biggest thing agents need to know is that this platform makes selling Medicare easier and more efficient. Agents can compare plans, enroll clients, and manage their book of business all in one place. And it's built to save them time, engage their beneficiaries, and help increase commissions.
Hey, that's awesome. Agents are busy, time is money, and I'm glad that we can give our users some extra minutes, hours, or even days back in AEP. So tell me though, what are some of the biggest pain points that PlanCompare Edge for agents will eliminate?
Yeah, absolutely. First, there's no more switching between multiple carrier portals. It consolidates everything into one spot. And secondly, it's a compliant platform similar to our FMO/agency and health plan platforms that have been backed for over 25 years with our healthcare technology and our Medicare industry experience. Third, it simplifies the quoting and enrollment process, which means that agents can close deals faster and serve their clients in a more efficiently timely manner.
So tell me about those carrier portals though. How does the carrier network on our platform benefit the agent?
The PlanCompare Edge gives agents access to a wide range of national and regional carriers. This allows them to offer more plan options to their clients, all within a single platform. This means agents can quickly compare plans across multiple carriers, find the best fit for each client, and close more sales without switching between multiple systems. With real-time updates and seamless enrollment, agents can stay competitive, compliant, and efficient. More carriers means more choices, more sales, and that equals more commissions. I'd like to add that we keep a list of current carriers, the Medicare products that they sell, and their enrollment status on our platform on connecture.com. We have a page dedicated to keeping agents up to date on our carrier list.
Great. So what's the experience like for agents that have switched to PlanCompare Edge for agents? Like, do you have any real life success stories from agents using the platform?
Yeah, absolutely. It's a great question. One of our top agents who owns his own Medicare agency and who has used other Connector DRX platforms shared that it was important to him that the agent solution was designed to be FMO agnostic. He said this gave him the confidence knowing he would retain ownership of his data, regardless of industry shifts among FMOs or any changes he needed to make. Additionally, the platform's scalability ensured it could grow with his agency as his needs evolved.
That's great. Did he share any other benefits on using the platform this past AEP?
Yeah, this past AEP, he was able to quickly gather information and seamlessly integrate with RetireFlow to collect scope of appointments, current medication lists, and other documents, reducing the need for customer handholding. He added that the most helpful features were the integrations with both RetireFlow and Agency Block. These allowed him to reduce the time spent on the data entry.
That's awesome. So for those who are ready to streamline their sales process and maximize commissions, what's the next step?
So the next step would be to visit connector.com/plan compare edge for agents, where you can review the benefits, see our frequently asked questions, and sign up directly on our website. For those that would like to stay on this webinar or view at any time, we are including a 20-minute detailed demo here, so agents can view this demo on connector.com or our YouTube page.
Great. Well, you heard it here first. PlanCompare Edge is the must-have tool for Medicare agents. Don't wait. Sign up today and take your sales to the next level. Thank you, Zach, and thank you to all of you for joining today. And now stay tuned as we play the demo of PlanCompare Edge for agents.
This is the PlanCompare Edge agents platform. This is an out-of-the-box solution, and so it does come as is. There's no branding, but I'll show you where you can add a profile picture for when you're sending out quotes or scopes of appointments. The first screen that you're going to see when you log into this platform is the agent dashboard. And the first thing that I want to point out is this would be your name as the agent up here in the top right. When you come to account overview, this is where you'd upload that profile picture for sending quotes or scopes of appointments. We do have an integration with RetireFlow as well. So this is an additional cost separate from our platform. But if you did send the survey out from our platform, it's a 10-question survey that's HIPAA compliant and CMS approved. And what it does is gather the updated drugs, doctors, pharmacy, and hospital information. And if this RetireFlow survey is sent from our platform, it'll actually populate our platform based off the beneficiary's responses. The PlanCompare Edge for Agents platform does come with a personalized URL as well. So if you copied this and put it into another window, this is the screen that you would see. This is going to have your name as the agent up here with that profile picture. And then the beneficiary can shop plans in their specific zip code for the carriers that you're certified and licensed to sell. The carriers that show up in your Pearl are specific to our carrier inventory list for the agent platform, which you can find on our website at connexure.com/PlanCompareEdge And as of right now, we do have 39 of our carrier partners that have some type of enrollment capability on the platform. The carriers that do have that enrollment capability will be in the orange lettering, and you'll want to make sure that you look at the far right side where it says quote and enroll. If there is a check mark there, you're going to want to also look at the plan types that are selected. So for example, Aetna/CVS has full enrollment capabilities for Medicare Advantage, MedSup, and PDP. If you see an S next to the check mark, that means shopping capabilities only. And if you see an E, it means an external link out. Shopping capabilities means that you'd still be able to see the plan details for that carrier. You wouldn't see if the provider was in network or not, but you'd still be able to see if the drugs were covered. And that would go along with the rest of our carrier partners that you see in the navy blue black color. You'd still be able to see the plan details for those carriers. You just would not see if the provider was in network or not if we did not have full enrollment capabilities with that specific carrier. Our goal is to have all of our carrier partners on this platform at some point in the future, and this inventory list is being updated on a monthly basis. When you go to the agent dashboard, there is a reporting tool that comes with the platform. So you can search a 31-day date range. You can search the entire calendar year, 31 days at a time. And then you can look for enrollment types, HRAs, or SOAs as well. You'll see this agent training materials right here. So we just launched a new learning management system last year. This would be videos and documents specific to the feature and functionality of this platform. It's really a self-help tool to become familiar with the platform. And then you'll also notice here the headers of enrollments, quotes, scope of appointment, and mymedicare.gov connections. So every time you send a quote, a scope of appointment, or this mymedicare.gov connection, you're going to be automatically asked to create a follow-up task, which would show up on this agent dashboard. You can consider these your in-flight tasks of where you're at with that specific beneficiary. And then I'm going to click into a profile. So this platform does come with CRM integration with Agency Block as of right now. And what that means is that this would be the first point of integration for Agency Block. And so you would start in a single client profile in your Agency Block CRM. Once the integration's set up, there's going to be a single sign-on button that you would click that would pull all of this demographic data into our platform to start building out the client profile. So name, date of birth, address, and email information, all of this gets pulled from your CRM. If you click on the beneficiary's name up here on the top right, you'll see that we're on the profile section. So you'd work your way down at the bottom of the page to the next screen until you got to that plan comparison page. This is where that integration with Retire Flow, where you can send that survey out from our platform. You can do it via email or text. And like I mentioned earlier, if you sent that survey out from our platform, it would update the provider's prescription and pharmacy information based off that beneficiary's response. You also see notes on the right-hand side here for tasks that were completed and done. And then at the very bottom of this page, you're going to move to the next section, which is the scope of appointment. You can email or text the scope of appointment. You could complete this form in person. You could do it over the phone, so we will provide the language to say. This platform does not come with a call recording feature. Most agents and agencies that we speak to do have a call recording system in place that would work with this. You could also print the form and then upload it back to the platform as well. This next section is the preferences section. So you'll see 3 different health categories at the top based off different parameters. You can toggle between these depending on that beneficiary's need. The age is going to automatically populate off that date of birth. And then you'll also see this feature, which is optional to use, but you can actually estimate the utilization of these benefits throughout the policy period. If you wanted to update this information, all you have to do is hit update. Let's say that the beneficiary is going to the chiropractor 10 times a year or sees a specialty care doctor once a month. You could also update that for whatever's relevant to that specific beneficiary. This section is the providers. So you can add 8 providers on this platform to see if they are network or not. You can look by doctor name or facility. We also do have this checkbox right here that you can mark for value-based care providers. So if that's something that you were interested in researching, you could also research for that for the providers. And then if you look, when we add a provider, you'll see that it's going to ask, are they the primary care physician? Is this a new patient? And like I said, you can add up to 8 on this platform. The next section is going to be the prescriptions tab. So I'm going to type in Lipitor as an example. You'll see the dose, quantity, and frequency for which the drugs are taken. We do have this generic alternative feature as well. So we do have a team of pharmacists on staff over here at ConnectYourDRX and over 40,000 different therapeutic alternatives. So let's say that there's a brand name drug that's on formulary, but it's not covered. We will provide the generic or therapeutic alternative if it's available. It could be a significant cost savings to the beneficiary and has the same medical benefits. But that being said, we're definitely not doctors. So it's information that you would give to the beneficiary, they would take to their provider to get the okay to switch drugs. And then we have this connection with mymedicare.gov. So if your beneficiary has a mymedicare.gov account, you can send them this email. You'll see this follow-up task gets automatically created, which is going to show up on the agent dashboard. And then the beneficiary is going to receive this email. It's going to have that profile picture that you uploaded, your contact information as the agent. Once the beneficiary logs into their mymedicare.gov account and grants you access to the prescription claims data, it would show the last 12 months of prescription claims right here in this tab. The pharmacy tab is next. So you can add up to 3 pharmacies on this. You can search by pharmacy name and zip code. And then we do have this digital pharmacy option as well. We do price our drugs down to the pharmacy and zip code level. We do not use local averages, and we do source our data directly from the carriers themselves. The final page is going to be that plan comparison page. So we did add ancillary plans last year. The first thing that I want to point out is this add non-licensed plans feature. So all the carriers that are in this navy blue black color, that is where you'd find the plan information about those carriers if the plan type is selected. What it's going to tell you is the cost of the plan and if the drugs are covered. If we don't have full enrollment capabilities on this platform for the carrier, it will not tell you if the provider is in network or not. And like I said, this inventory list is being updated on a monthly basis. So if you want to check this inventory list out to see what carriers are being added, just go to connecture.com/PlanCompareEdge agents. When you come down, you'll see that you have a filter for plan premium, max out of pocket, or estimated drug costs. You can select whatever you choose to. There's also additional filters on this left-hand side. So Part B give back is a big deal, or fitness benefits. You can select that. And then if you look at this estimated drug cost, you'll see that that price changes when we select between pharmacies, just reiterating that we do price down to that pharmacy level. And then the agent can select up to 3 quotes to compare. You'll see a compare now button pop up that you click. This screen will show you the differences in the yellowish orange color between those quotes. There's going to be plan documents that are at the bottom of this page that are specific to the carrier, and that provider information would show too. These are just demo plans, so it's not showing any information there. And like I said, there is plan documents at the bottom of this page that are specific to that carrier. And if you wanted to send a quote, all you have to do is hit send quote. You can email or text it. You can write a personalized message, and you can select the pharmacy for which you want to send that quote for. So we'll go ahead and send this quote. What you'll see is that follow-up task that's automatically created. That's going to show up on the agent dashboard. And then the beneficiary is going to receive 2 different emails. The first one is going to be the authorization code to be CMS compliant. And then the second one is going to be to view the quotes itself. So now we're looking from the beneficiary's perspective. The agent had sent them a quote. The first screen that they'll see when they hit view quote is this page right here. It's going to have that profile picture of the agent that they uploaded on the platform, their contact information, and then the beneficiary just entering that authorization code. What they'll see is all the preference information that we had input before we got to that plan comparison page. They could edit this and it would relay back to our platform in real time. They could hit add to cart, which would start the enrollment process from right here where the agent would get credit. They could go into plan details, which would show more detailed of pharmacy coverage, prescription coverage, and the yearly cost for that policy period. The beneficiary could compare these plans, which we just saw from the broker-facing side, or they could shop all available plans that that agent is certified and licensed to sell in their area. It does come back to what carriers that we do have full enrollment capabilities with. And then I'm going to do an enrollment from the broker-facing side. So let's say that the beneficiary was interested in this plan. All I have to do is hit add to cart to start the enrollment process. And you'll see optional add-on coverages for dental, hearing, and vision, or a package option as well. You could send this to the beneficiary to sign and submit, or you could complete the form with them, which we'll do for this demo purpose. So you'll see here the pre-enrollment statements that you'll have to go through and check before you move forward with this enrollment process. And then our enrollment forms are universal. The questions that are asked are specific to the carrier. If they did want a specific question asked, you'd walk through the standard enrollment form. You'll see the Medicare number, the Part A, Part B effective dates. There's drop downs for the questions that are being asked. And then you'll see here the standard questions that are asked during the enrollment process. And then at the bottom, how does that beneficiary want to receive the plan formulary, the summary of benefits, and the evidence of coverage, the payment information, so how they get the bill in the mail, an electronic funds transfer, or an automatic deduction from their Social Security, the agent attestation, the statement of understanding, and then we have this wet signature feature as well that's built into the platform. You'll see 3 different options that you can select, and you see how that works. The last page that you'll see is a summary of the previous screens that we just completed. You could click on that to drop it down to validate that the information you input is accurate. You could gather the voice signature. So we will give the verbiage that you need to say to gather that voice signature. Again, this platform does not come with a call recording feature, but you can use the one that you currently have to gather that voice signature. When you hit submit enrollment, you'll see application details on the right-hand side. And there's a couple of things that I want to point out when you see those application details. First, you could print a PDF of the application you just submitted. And then this confirmation number is very important because ConnectYourDRX is a third-party technology vendor. We are not an agency. And so we're going to give you the confirmation number that we're going to submit this to our carrier partners. We do submit nightly enrollment files, but you're going to have to check the carrier's website to see if that policy is approved or denied. And then this is also the second point of integration with Agency Block. So first, it would be starting in a single client profile in Agency Block. Once you hit the single sign-on button to pull in the demographic data to build out the client profile, it comes with a unique identifier. And that way, when you submit the enrollment, these application details are being sent back to that same unique identifier. And that is the second part of the integration. There will be next steps depending on what carrier you sign them up with. So if a health risk assessment is needed, it will let you know. But this really walks us through what a full enrollment on the platform looks like for PlanCompare Edge for agents. I thank you for taking the time to watch this today. And if you have any questions, please do reach out. Thank you so much.